Hi everyone, my name is Brandy and I kind of wanted to make this video for other people who are in a similar situation like myself. I am 41 years old and I'm a mom of four. My oldest is 24, my second is 14, my third is 8, and my youngest is 1. Um, so I have a baby and I am getting ready to go through the ACDF surgery, which stands for anterior cervical discectomy and fusion. So I'm not able to find anything on the internet at all regarding like anyone else who's gone through the same thing with a baby. So um, I wanted to make one of my own for others. And okay, so a lot of people ask, like, how did this happen? How did you get something wrong with your neck? Did you have a car accident? What happened? Um, well, I don't really know. And obviously I'm a little nervous being on camera. I don't even take selfies. I'm very nervous about being in front of the camera. But if it's this video and this process that I'm going to start posting my videos about helps somebody else, then that's the reason I'm doing it. So no, I didn't have anything like any kind of specific trauma that happened to me that I can remember. I used to ride a lot of roller coasters when I was young. And I remember kind of thinking, like reading, on the roller coasters, they say, you can't go on them if you have any problems with your neck or this or spine. And I just think, like, how does anybody really know? But I was young. I was 10 years old and I was riding like the scariest roller coasters ever. And I was doing this all the time, like multiple times a year. And every theme park I'd go to, I'd ride them maybe, 10 times each if I could. So I rode a lot of roller coasters. But even going back further than that, like I always had bad handwriting. I was a straight A student and everything else, but my handwriting sucks. And it always has. And it's like I've always told people that I just sort of have a disconnect from my hand to my brain. And so I just work really fast. I'm from the San Francisco Bay Area, and we're kind of fast-paced people anyways, like get it done, be proactive, just work quickly. And so for years, decades, I've been able to just mask my small tremor that I have, just like any problems that I have with my fine motor skills with my hands. I've just been able to mask it by just working really fast, and people just don't notice. Although one time I was working as a medical assistant when I was young. I was 22. And the doctor that I was working for, he saw me pouring a little, it was early morning, so my blood sugar was probably low anyway, but I was pouring a cup of Tylenol for a patient that I had just given their baby's shots to into a cup to measure the amount, and my hand was shaking really bad. And he's like, "Are you okay?" And I was so embarrassed. I was like, "Yeah, I'm fine. I'm fine. Like nothing's wrong with me. I promise I like don't do anything bad. It's just me." So I've worked for many years trying to hide it, and then when I was 19, I was in a very bad car accident when I was 19 in San Francisco. I had an ex-boyfriend who was in my car driving, and I was in the passenger seat, and he was turning left, but then a whole bunch of people decided to jaywalk across the street, so he wasn't able to get through the intersection, and a car coming straight on us was going about 45 miles an hour, and he was watching the airplane show in the air instead of the road, and he slammed into my side of the seat, which I then went to the emergency room, and I did have pain in between my shoulder blades, and the doctors there just said I was just in shock and nothing was wrong with me, and they sent me home. So that's when I was 19 years old. After that, I've done a lot of different things. Like I've hit multiple deer in the road and totaled my car. Just over time, since I was about 22 years old, I noticed that my I had a very bad pain in between the middle of my shoulder blades, and I just thought it was just a muscle spasm. So like sometimes I would take Scalaxin for it, and it helped in the beginning, then it stopped helping. So then I stopped taking it. What else? So 22 years old is when I really started feeling that pain between my shoulder blades. And by the time I was, I don't know, early 30s, maybe 34, 35-ish, maybe mid 30s, I started going to a chiropractor, and he helped me so much. Like, he did my x-rays, and from an x-ray you can't really see that much, and he said, did you know your neck was backwards? And it's not really backwards, but just it was very misshapen. And I said, no. And he said, well, has anyone mentioned to you scoliosis in your upper back, like kind of in between my shoulder blades, where I thought that was the source of the pain? And I was like, no, I've never really gone to get treatment for this. Like, I've never sought help. I've never asked for pain medicine. Like, I've never went to a doctor for this before coming to this chiropractor. And so he started giving me like chiropractic manipulations in my spine, and he had been in practice for many, many years, and he would crack my neck, and it was wonderful. Like, he really, really helped me a lot. For about a year and a half, he kept the pain away, and that pain between my shoulder blades, and it was so much relief. Then I had a negative experience with a chiropractor who cracked my neck, and I think he herniated the 2 discs that are now in my neck herniated, but that was just in addition to the problem that was already happening. See, the pain in between my shoulder blades wasn't actually from my scoliosis at all. It was actually like misplaced nerve pain, and all stemming from my neck problem. But it took a long road before we could figure it out, because I'm young, I was healthy, and nobody expected me to have such a yucky looking neck inside, and broken for decades that I had. So what came down to it is, after that last chiropractic manipulation of my neck, and I was in severe pain for a lot of years, maybe 5 years. Then the headaches were just so bad that I couldn't take it anymore, and it became to a point where I couldn't even get out of bed. And that's when my husband was like, you're going to the doctor right now. Like, I can't, I'm the mother of all these children, and they need me. So he took me to, he's like, something's wrong. This is not right. This is not normal. So he took me to the emergency room, and they did a CAT scan, which you may or may not know, an x-ray and a CAT scan, they don't show the soft tissues like an MRI does. So they still didn't really fully get a full picture of what was going on inside my neck. So they said, okay, there's a lot of bone spurs in there, but we're just going to go ahead and give you physical therapy, and we're going to send you to neurology, and we'll just go from there. So physical therapy helped. I mean, it definitely, the exercises that I was taught helped keep the edge off of the pain, especially in the mornings. I have to stretch my neck a lot to get sort of everything moving. So it just kind of takes the edge off. And then I started going to my neurologist, who has been amazing, but I'll get to that. He first took a look at my CAT scan, and he said, okay, well, let's finish out the physical therapy, and then let's go, I want to get another x-ray of your neck. And I'm sorry, I'm fighting the end of a cold as well. So this is going to be fun. I'm really hoping to be over all of this. Like, how you have a cold, and then all of a sudden, you have that lingering cough. That's what's going on with me right now, and my voice is scratchy, and I have surgery in like 5 days. So I'm really hoping and praying that it'll be gone by the time I have surgery. So anyways, back to my neurologist. He was very awesome. I mean, he was just so thorough. He checked my reflexes, he checked my strength, and he's like, okay, well, your strength is good. And he put me on baclofen, which really helped me with the tensing. Like, my shoulders were just, I remember looking in the mirror at my shoulders, and I was so hunched over. I mean, I think I had lost like an inch in height because I was so hunched over, because it was so abnormally tight. And I didn't even realize that was what was going on. I thought, okay, well, I'm almost 40. You know, this is what's going on with me. I guess this happens to people when they're 40. Like, this is my body now. I'm getting older. That wasn't really the case. It was all about my neck. So he started me on the baclofen, and the muscles just sort of released off of my clamping down like they were on my shoulders. And so the injury, it's more crushed on the right side than it is on the left. So they said that because the damage is mostly on the right, that you feel it more on the left. So that's what's going on with me. He started me on the baclofen, and it was amazing. But about like 3 months into taking the baclofen, I found out that I was pregnant. So I went through my pregnancy and stayed on the baclofen just twice a day. I really needed to go up to that 3rd time a day because it has a really short half-life for me. I had to take it maybe every 6 hours, and I was taking it every 12. So I went through the pregnancy taking the baclofen twice a day because I couldn't, basically was going to go back to if I didn't. So I would continue that, and baby's fine. Everything was fine, normal. Then I got COVID really bad during my pregnancy. I had it severe. I was giving myself shots of blood thinners in the pregnant stomach for 30 days, which was a nightmare. My fever was like almost around 105, and like, I didn't know if I was going to survive COVID, but I did. And this is in the early on phases of COVID, so I really didn't know what to expect at the time, and most doctors didn't really know what they were looking at. So it was a scary time. But after that, towards the end of my pregnancy, I noticed that I was really wobbly, and I'm like, okay, so my, I've had a lot of kids. My hips are just, my joints are loose because they're getting ready for the baby and labor and delivery. So then after my pregnancy, I was like, well, things should start to regulate after I have the baby. So when they didn't, and I was still, I could tell, like, my feet, I felt like from my mid calf down, I felt like I was dragging my legs through the mud. And when I talk to other people about it, they're like, I don't understand, like, your nerves in your neck don't affect the nerves in your legs, but it actually does. And for me, I felt like I was dragging my legs through the mud, and also real wobbly still, like in my hips. And I do think that part of that was the pregnancy hormones getting ready for birth, and sometimes it takes a long time for that to regulate and go back to normal. But a lot of it was just, I don't know. So I had a walking stick and everything. I still have it because I really need it, but I don't walk that long of distances to for it to matter all that much. And I'm at the point right now where I can't really lift my son. My arms are so weak. And that's another thing, is for years I've been like, my arms are so weak, I can't lift things like I used to. But I just chalked it up to, just getting older, having all these kids, like my body's just wearing out. I had no idea that this actually was a symptom of what was going on inside my neck. So Right now I'm not lifting my baby, so I'm not carrying him far different distances. I am lifting him some, but my arms are just very weak. I don't trust my own body. So that's what's going on with that. Um, then I told my neurologist about it, and he sent me for an MRI. And really, that is when he found that my neck is like crushed, like it's like going all the way down. It is pressing on the spinal cord, and someone had said that my posterior ligament has basically turned into bone. It's from an old injury that's been there for a really long time. We don't really know the exact one to know how long it's been there, but it got overstretched and then went back. And as the healing process happened for that ligament, it turned to bone, and it is crushing now my spinal cord. I can't say crushing. I say crushing all the time. It is pressing. It is compressing my spinal cord. And then there's all these other little bone growths, which one doctor explained it to me. One surgeon explained it to me like they are bone spurs, but another surgeon said it's not really bone spurs. It's like this complex system of ossified ligament. And it's, one other surgeon also said it's going to be kind of tricky to drill it out. So that word sort of made me nervous. And so he sent me to a surgeon, and I talked to him about it, and then I talked to 2 more surgeons about it, and then I made my decision. One surgeon had recommended the cervical disc replacement, which is sort of like a metal prosthetic disc that they take out your old disc, clean out all the bone spurs and everything, and then they insert the little metal prosthetic disc. I didn't want to go that route because I had done some research, and I found out that there's another surgeon in South Florida who put on a video, and he was explaining how a lot of patients who've had that done, if they have not had or if they have any abnormalities with their ligaments, they come into him and they're complaining that they're having a hard time holding up their head. So I didn't want that to happen to me. That really scared me. I just didn't want to go through that. And I don't know if that's true. I don't know if that actually happens. I don't have firsthand experience with that, but I just know that my ligament is not normal, and the ACDF surgery is sort of the gold standard for this type of neck fixing. However, it's been so long, and I've been dealing with all this nerve stuff for so long that we just don't know if I'm going to have residual existing nerve damage after the surgery, or if I'm going to feel better. One surgeon told me we don't want to bring you into surgery and then you leave surgery feeling worse than when you went into it. So that's sort of like the gauge for when to wait and when to have the surgery. I went to my neurologist, and he did check my reflexes, and he said, now I'm experiencing hyporeflexia in my legs. And I don't know about anywhere else, but I do know he said my legs for sure. And that means that there's a disconnect somewhere between my brain and my muscles, and the signal that is like I will kick my leg out, but usually there's like a signal that the brain will tell the leg, like, well, don't kick, like, yeah, something's touching my leg, but don't kick the thing across the room, like have some constraint. But I'm missing that signal now. I don't really want to go through that. And also, I was told that if I was hit, by rear-ended by a car going 20 miles an hour, that I could be paralyzed at this point. And that would be from my arms down. And, I've thought a lot about it, and I feel that I would be okay to lose my legs, but not my arms. I have to hug and hold my children, and I want to hug and hold my grandchildren. And so we're going to surgery. And I went and saw the surgeon that I chose to perform my surgery. And I wanted to get his second opinion on, or well, I guess I've already had his second opinion, but I wanted to get his next opinion. He had told me initially a year earlier to go ahead and wait. He said if you were my wife, I would wait until basically I felt the burn going all the way down my arms and everything. Which I did, but my neurologist put me on Cymbalta, and it worked so well to kick that burn out that I felt fine. So I went back to him, had a second MRI, went back to him, had him look at it, and the MRIs that I had were a year apart. So the first one said that the areas in my neck were moderate to severe, and then this new one is saying that it's severe. So he came in the room and he said, okay, I think it's time. He said, you're risking a lot by not doing it. And I know some people say, well, you have the same risks, like if you get in a car accident or fall off the roof or anything like that, like you have the same risks of being paralyzed. So what's the difference? And the difference is I don't have to do that much right now to paralyze myself. Like just falling on the ground from a standing position could be enough to do that to me. As a whole person who doesn't have any damage to the inside of their neck, it would have to be a significant amount of trauma to do that kind of damage and to paralyze them. And I'm kind of walking on eggshells. So this surgery will be to stabilize. I'm doing a 2-level. It's going to be C5 and C6, C6 and C7. And it's going to stabilize my neck. However, I am going to be at high risk for, what's it called? Like adjacent disc disease, where the metal plate, he explained it to me. He said normally they do this on older people. They don't like to do it on people who are younger, which I am still considered younger. They normally look for the natural crease in the neck, but since I don't have one, he'll have to create one. He'll mark my neck and he'll cut it. He said he just wants like to see about this much space right here, and a tractor thing will like pull everything back so that he can work, and he will remove the discs, and then he'll drill all the way to the spinal cord to clear out all the debris, all the bone growth that's pressing on the spinal cord has to come out. And this man has a lot of skills. So I do trust him, and I'm thankful that I've had so many options, because some people just don't even know what they're getting into. They don't even realize that they have options. So anyways, after they remove the discs and clean everything out, they rinse it out, and then they insert this cage. It's like a little small piece about the size of your disc that goes in between the vertebrae, and it is filled with synthetic materials as well as powdered parts of cadaver bone, which will then since I'm doing a 2-level, they're going to remove the 2 discs, put 2 of those cages in, and then put this titanium plate that's probably about this big, and they're going to screw it on the bottom, top, and in the middle, and that plate will sort of just help keep everything stabilized, I guess, until my natural vertebrae fuse together with the cage. So that's what I'm looking at. I'm really nervous about it, and the reason I'm nervous is because I've never really taken prescription pain medication. I've never been put under anesthesia. I've never had any kind of, I've never had my wisdom teeth removed, and mostly because I was afraid of being put to sleep for it. So I don't like to feel outside of my right mind, but I know that I'm definitely going to need the pain medication for when I wake up from this. And I'm thankful that I have the option to have it. So I just wanted to kind of show y'all my neck before. It's a normal non-scarred up neck. My husband's a little bit nervous about me having this cough, and I'm like, well, today is Saturday. I don't have anything in my lungs. It's just the residual, like the drainage. Like the cold started about 2 weeks ago, and it was really bad like the first week, but now it's just that annoying like leftover cold stuff that's going on. So I should be fine. And if I'm not, then I'm sure they'll let me know. So anyway, and on top of everything else, I have a 1-year-old that I'm really nervous about having the recovery process with. So I knew that I needed the surgery early on. When he was 2 months old is when I found out. And now he will be 2 years old in 8 months from now. So I waited a long time, tried to get him grown. I've tried to wean him, but it has not worked 100%. He's still nursing at night, mostly to get to sleep and to stay asleep, because my husband works a lot of nights, so he can't help me out. And so the weaning has not gone well. I'm the most nervous about how it's going to affect me mentally, not being able to nurse him anymore. The doctor said that my body needs to focus all of its effort and energy on fusing my neck to the cages. So my calcium needs to be going to my neck and not to my milk production. So he said I could still be producing at the time of surgery, but I can no longer be feeding it off. I'm also kind of prone to mastitis, so I've had 2 with this child already, and so I'm a little bit nervous about that, but I think everything's gonna work out. I mean, it just has to. Like, what other choices are there, you know? It's gonna be okay. He's more independent now. He's walking around. He's able to get things. I can hand him his sippy cup. He's able to drink his water, eat his food by himself. Like, he's able to do those things. It's just mentally, like, he's going to want that. He's going to want a nurse for a long time. And I'm not even going to be able to really see him because he's going to lock eyes on me. He's going to want me. And the other part is I can't lift him. And I really can't risk him even bumping me, like, for the first 30 days at least, and then I can't lift him at all for at least 3 months. I won't even be able to lift him up to put him on my lap. So I'm a little bit nervous about that. There's just a lot to think about. My husband is going to take the first month off from work, and he's been so helpful to me. I've done my research, and I've bought so many things that I think are going to help me out to so I'm not just sitting in the room bored. I'm going to try to keep my distance from the baby for the first month, just so that I have time to for things to really settle in and heal after the surgery without getting bumped, or, you know, my mind getting stressed out because I really want to hold my baby and I can't. That's going to be the hardest part for me. So anyways, I will make later videos showing you, like, the things that I have and the things that I've purchased to prepare for this surgery that I think are going to be helpful, and also the things that later on I'll after I get a chance to use everything, I'll let you know what was actually helpful and what I wasted my money on, basically. Excuse me. So, anyways, I just wanted to introduce myself and tell you my backstory. So that's it. And sorry, I don't make that good of eye contact. I'm very nervous about looking at myself on camera. So anyways, I hope this helps somebody, and we will talk more soon. Bye. Thank you.